Today I will be discussing the topics of miscarriage, which I will be discussing what a miscarriage is, some causes of it, some of the risk factors you may have, how to prevent a miscarriage, and what a miscarriage does to your body. All right, a miscarriage is whenever a woman has a spontaneous loss of her baby before the 20-week mark. And most people don't believe that miscarriages are that common. Well, it is said that 1 in 4 women have a miscarriage, and there is accounted 6.2 million pregnancies in the United States a year, but roughly 1 million of those end in a miscarriage. And when a baby is miscarried, it is about the size of your pinky fingernail, which about that time, it's at the 6-week mark is whenever it's usually happening. And some of the causes of a miscarriage is either some genetics, which you can't really prevent that. It's either the embryo didn't divide correctly, or there was just damage to the sperm or the egg, which it would have never been a successful pregnancy if either one of those happened. So it's kind of the way of the body ending it. And then infections happen because pregnant women are often more vulnerable to infections because their immune system is changing, there's changes in the body systems, and they're just more vulnerable to getting sick and infections happening and hurting the baby. And then some of the lifestyle habits, such as obesity, drug and alcohol use, and certain medications, are also play a major role in what happens in a pregnancy, because obesity, it can cause problems along the way. And it's kind of common knowledge. Most people know you don't use drugs or drink any alcohol when you're pregnant because it is very harmful to the baby. And then certain medications also are harmful, which I'll go more into that in a minute. And it is said that it's also the body's just natural way of ending a problematic pregnancy or ending something that the baby was not going to be healthy along the way. And then some risk factors, you're more at risk of having a miscarriage if you are older. It's said that the older you get, the higher of a risk you are. And then the earlier you are in your trimesters, that also plays a major role. And if the longer you've been pregnant, it says that it gets easier and that you won't be as more at risk. And then obesity, like I was saying, most overweight people have problems and health concerns that put the baby at risk, such as diabetes, high blood pressure, and heart diseases. And the medications just aren't really that safe if you don't ask your doctor about them. That's why obesity is also a problem, because many obese people take all these medications to help with their underlying problems and how to help them live, but it's also harmful to that baby. Which a good way to prevent these things from happening is get a handle on your stress, ask your doctor about your medication, even if it's just Tylenol, eat a well-balanced diet, get plenty of exercise, but don't overdo it because that will add stress to your body, reduce your caffeine intake, have regular prenatal doctor appointments so they can constantly be checking on the baby and making sure everything is working as it should be. And then some pain that happens and like the outcomes is you have physical pain, cramping, bleeding, which is how most people know they're having a miscarriage, is when they are bleeding. You get chills, you start to feel very sick, which it gets very hard to tell if it's from feeling sick because many women experience morning sickness and just sickness to foods. And so, but you'll also develop skin rashes. And then not only do you experience the physical pain, but it also takes a very large emotional toll on you, which is such as feeling grief, you're feeling the shock, you feel like you're wrong, you had failure and guilt in you. You feel like you're very empty because you just lost your baby, and then you feel like you can't control anything, and your fear, you have a lot of that, and then you just feel lost, like you don't know what to do after that. And then as a conclusion, we have learned now that miscarriages are very common, and sometimes there's nothing you can do to prevent it. So therefore, I feel like we should normalize the talk and the support of those who are struggling with miscarriages, because they can't help that it happened to them. But if everybody comes together and be a support system towards those women, then that would be a great thing towards our world.